Good morning, everybody. It's a little bit of a sad day after listening to the morning news. And so I hope we can manage to concentrate on the topic of today. You're connected with the UN building in Vienna to the Zero project from where I'm talking. And this session, which is organized by ESPD, fits into the overall program of the Zero project. A warm welcome to our speakers and to the participants, the attendees of this meeting. I will start to share my screen, and then we can kick off our meeting. So my name is Evert-Jan Hogewerf. I'm a service provider myself. I work in AAS Bologna, almost where I direct an Assistive Technology Center. And I'm also part of the ESPD board and co-chair of the Person-Centered Technology Membership Forum. Before I introduce the speakers to you, just a brief overview of what the session is about. It's called Technology in Social Care and Support Services. And that is a topic which is close to the heart of ESPD. For those of you that don't know ESPD stands for the European Association of Service Providers to Persons with Disabilities. And it's a non-for-profit NGO in the disability sector with its base in Brussels. It represents a tremendous amount of service providers, directly or indirectly through umbrella bodies that are a member of ESPD. And what always strikes me when I talk about ESPD is that it's focused on the rights of persons with disabilities. And it very, very clearly connects the quality of service that are provided to persons with disabilities to what extent these actually fulfill the rights as outlined by the UN Convention. Within ESPD, there's a Person-Centered Technology Membership Forum, and we are meeting and discussing and planning activities as a membership forum. So this session is very much about the digitalization process in society and how it affects our sector, which could be described as the social care and support sector. Digitalization is a process that affects many sectors in society, basically all. So the question is, how does it affect our sector? And we all know that important opportunities are provided to service providers by the digitalization process. For example, new technology-based solutions for the empowerment of users. Research is moving forward. New opportunities provided by digital technologies also leads to new assistive technologies or assistive technology-based solutions. And but also new ways of delivering services remotely, when and where needed, in case there's connectivity. So we've been studying as a membership forum the process for a while. There's also a report that you can find on the ESPD website about how this is affecting our sector. And actually why we are so happy to be here today is that because we want to further, let's say, turn the information that we have and the feedback that we receive from our members into something which is really a sort of a policy paper and really looking into how the social care sector can actively contribute to the development of a more, say, inclusive society. So the topics that we're going to discuss today is as already mentioned, the impact of the digitalization process on the sector, the role that the sector can have in making sure that that process is also leading to social benefits, not only for the people that we support, but also for others. Then what the priorities that we have to give ourselves if we want to capture that momentum, and what are the expected outcomes of that digitalization process, and how can we measure those outcomes? So how can we make sure that we actually reach our goals in this field? I have a fantastic panel today. It's really amazing. There's May Agius from Aġenzija Sapport in Malta, Noah, Nissan from the Digitisation Shapiro organization in Israel, and Klaus Miesenberger from the Johannes Kepler University in Linz. So I'm going to ask them to introduce themselves quickly, and then we will kick off with our discussion. May, can I start with you?
I'm just unmuting myself. Okay, yes, you can. So I'm just going to share very briefly a slide just that represents my organization. Are you able to see that?
It's coming up.
Okay.
Yeah.
I work for Aġenzija Sapport, as Jan just said. Aġenzija Sapport is a national disability agency in Malta. And on the right-hand side, you can see that the agency provides a whole variety of services, and there's 10 of them there, including things like residential and day services. Also provides sign language interpretation, which is something very important during the COVID periods. They provide funding through their schemes for many of the technologies that are utilized by people with disabilities. I work as a part of ACTU, which is the Access to Communication and Technology Unit. And I'm assistive technology practitioner within that team. My background is speech and language therapy. I'm also a lecturer at the university locally. And I'm a senior speech and language therapist within ACTU, which is the National Assistive Technology team for Malta. Our mission is to support independence using assistive technology. And my role on this team is to assess and make recommendations for assistive technology for children and adults. My particular focus is augmentative alternative communication, but of course I have to look at that in the wider context. And I'm also involved in service delivery and have input in local policy making. I'm also Evert Jan's other co-chair for the PCT forum within ESPD, and my special interest is AAC for those who have autism or who are bilingual. And especially, I'm very interested in how we use technology generally in terms of our interventions. So I'll hand you on. Yeah.
Yeah, fantastic. Thank you, May. Noah, can you briefly present yourself? And can you stop sharing your screen? Yeah.
Okay. Yeah, so I will share my screen. Hi, everyone. Good morning. Okay. Oops, it's not the right one. Sorry. Okay, so you see my slide, right?
Yes, we can see it.
Okay, so my name is Noah Nitzan. I'm an occupational therapist in my background, and I'm the director of the Technology Center at Digitisation Shapiro. Digitisation Shapiro is one of the leading organizations in Israel in the field of disabilities. We're working for decades already. And we work with a wide range of disabilities, all kinds of disabilities in all ages and across multiple cultures. And this is something very important. We're impacting 500,000 people each year because the way we work here is not just about services, it's about identify a need, develop a solution, do research, and then scale it up. So that's how we get to so many people. We work in Israel and globally. We have also special consultant status at the UN. And I just want to mention what kind of services we have because it's relevant to what we are talking. So we have educational framework. We have early intervention center for very young children here in Ra'anana, where I stay in the center of the country, but also in Kalansoa, which is an Arabic city. We have special education school. We have a lot of other therapeutic services like hydrotherapy, emotional therapy, special dental clinic, and more. But we have also department like training institute, research, and we have a lot of community work, including amazing work of a leadership group and self-advocacy. So this is for now.
Fantastic, Noah. Thank you very much. That was very informative. Klaus?
Thank you very much, Evert Jan, having me. First of all, I'm a member of ESPD and work with the PCT group, which I'm very proud of and benefit a lot. My background, I'm professor for computer science at the University of Linz. And in about 35 years ago, we started in early times of digitization, we started an activity of research in assistive technology and accessibility. And at that time, we set up a support center for students with disabilities, so to say, as a research lab, allowing us to do user-centered research and development. And so to say, this is the work which I'm doing since 35 years, supporting students with disabilities at university with a strong focus on digitization since more than 30 years, because, so to say, all the content, what students are studying has to be available in digital format. And from there, we provide accessibility, assistive technology, consultancy training, and things like that to allow an inclusive experience for students with disabilities. And based on this, we define our research subjects, we define our teaching. We are teaching accessibility for all IT subjects at university. It is at our university a compulsory subject. Every IT student has to do a lecture in accessible software, web development, and students can also specialize in assistive technologies as a subject. This is a short background.
Fantastic. Thank you, Klaus. Okay, so we're going to do it like this. We will have 2 discussion rounds and some presentations in the middle from our panelists to tell a little bit more about what's happening actually in their organization. But let me first start with a question for May, and basically it's the same question for everybody, for Klaus and for Noah as well. So. From your perspective, which by the way is very nice, you have an occupational therapist, speech and language therapist, and a computer scientist. So that's all you need when you talk about innovation and assistive technology, actually. But from your perspective, May, how do you see the impact of this digitalization process on our sector? And also, how do you think we can really sort of, what is important to make sure that it's actually, what is the role of the sector in making sure that this is also leading to a more inclusive society? Let me summarize it like this. Can you please?
Let me just unmute. I think this is absolutely huge question. And thank you for making me answer this question first. Right. The impact of digitalization on the sector, as in my field?
Yeah.
Okay. I think it's, in a certain extent, I think it crept up on us, and I think that maybe we were slowly moving there. This is definitely for us here in Malta, I think, and that when COVID hit us, we had to suddenly pick up the ball and run with it. And I think that for some of us, it was easier than it was for others. I'd like to think that the impact is positive, and I can see that there are things in terms of efficiency of services that we can definitely see an impact there for us. Also for our service users, I'm not just talking about the ones that attend my team services, but also other services that they're now able to maybe access things they couldn't access before more easily, especially. For example, for those who are living, maybe, I know you think Malta is small, but maybe for people living in places like Gozo, they don't have to wait for me to come 2 months down the line. I can organize a session with them immediately if need be and give them help if they need that. So this has definitely had a huge impact from that perspective, and therefore creating a more equitable service for people who are maybe living far away from services and we're not able to access them as easily. And they were dependent on us to schedule them. Now we can actually meet their needs in a more timely manner. And also, I think the other impact has been that people are now able to maybe communicate with other people who aren't necessarily with them. Before, they maybe were aware of these technologies, but they had to learn to use them now, and they are using them. So that's just a start. I've probably gone about this for an hour.
No, fantastic. Yeah, I think you touched upon some very interesting points, and probably without mentioning the COVID pandemic, which is actually a bit of an achievement nowadays to talk about this without mentioning the pandemic. Noah, what would you respond to that question? I mean, what is the impact from your perspective?
So I think there are a few areas that really affected, and there are advantages and disadvantages, of course, that we have to address. So if you think about, for example, education, so students with disability today, we have the tools because of the pandemic. And we have the tools to stay in touch when they are at home due to a surgery, for example, things like this. Or so we start to use tools like the Zoom that we never used before the pandemic. It's the same with therapy or OT, speech therapies, emotional therapy, physiotherapy. Now we know how to do it in distance if we need to. And I think that one of the main areas is the health system. And this is very important because we see that there is really the digitalization process really influence the health system, because we know now that we have an appointment with an app, with the website. And now even for myself, I have much more remote session with my doctor, my children doctor, which is really great, much more accessible, could be great for people with disability. At the same time, not enough accessible. And this is a very good example how it could really close the gap, but also make it bigger. And we have to consider, because people have to have the best and convenient way to make an appointment and to see their results. It also influences employment, because today many people work from home. And again, there are great advantage for people with disability to work from home, but we don't want people to stay at home all day. It's very important to go out. So we have to think about this balance, and also about independence. So all the area of smart homes, and this is not about the pandemic, but about the digitalization in general, smart homes, all the great app that we have for navigation, for public transportation, we see more and more, and we have to consider how to think about people with disability in those areas. And I think that we need to be part of this ecosystem. We have to work together, because the developers and the company of the smart home, etc., they just don't aware the great influence they can have and how they can really help in this area. So we have to work together.
Fantastic. No, yeah, that's they're all relevant points, and I particularly liked how you fleshed it out into the different sectors of participation of people with disabilities in society. So education, employment, health. Yeah, that's definitely true. Klaus, from your perspective at university, supporting your students, I mean, have you seen that the digitalization is leading to increasing opportunities for them to fully participate in university? And in general, I'd like to ask you, sorry, this is a bit maybe unprepared question for you, but I know you can manage it. What about the digital divide? Do you think there's a digital divide that excludes people with disabilities still, or is that gradually disappearing?
Mm-hmm. Thanks for the question. For the first one, I'm happy to say that the whole digitization is what we were working towards since 35 years, because our vision at that time was everything what is digital allows a more flexible presentation, multimedia, and a more flexible interaction, multimodality. And therefore, whatever becomes digital provides a huge potential for people with disabilities, because then we can adapt the processes. And therefore, it has been very positive. A lot of, so to say, problems we experienced because lecturers, the environment was not prepared. We had problems in getting access to digital books. We had problems in getting access to lecture notes and things like that. And the more and more digitization progressed, let's say the last 10, 15 years, the easier it became for us to get access to these different content domains. And therefore, this was for us really positive, becoming through what we expected, that we get access to the digital content, to the digital environment. And therefore, yes, very, very positive in that sense. But also, I think we have to say that digitization reinforces the good, the potential, but also reinforces the risks. If you are at a social exclusion, if you have problems taking part as a student at the campus itself, it is a risk, because there are immediately lecturers saying, okay, we record the lecture and you can stay home. And so to say, by the goodwill. We do the contrary of inclusion by providing digital means, because the way to university is hindered for people with disabilities. And therefore, so to say, the focus on the social inclusion, the social participation becomes more and more important. People have the means at hand to be independent, to take part, to have access, but the role or the responsibility of services to allow this social participation, this full experience, that they can decide and determine themselves when to be where and what to do online and what to do face to face. This is much more important, this guidance, than it was before. The focus was on accessibility the years ago. Now it's on the social inclusion and the experience for people with disabilities being part of it.
Yeah, I think that's a very nice point, Klaus, that you mentioned there. So on the one hand, we have these huge opportunities also especially for people with disabilities, I would say. But at the same time, we have to be very careful. That's probably the role of service providers, to make sure that it doesn't lead to new forms of exclusion, for example. Mm-hmm. And yeah, I think that is something which could also guide us a little bit later in the discussion when we talk about let's say the priorities that we have to give ourselves as a sector. Thank you for this first round. Just for the audience, you will have an opportunity as well to step into the discussion a little bit later, if you don't mind, because I've also asked our panelists to prepare a short presentation about what's actually going on at the level of digitalization within their organization. So I'm going to hand over again to May, if you don't mind, May, start again and to show us what you want to talk about.
Okay, can you see my screen?
Yes, it's okay.
Okay, just want to turn the slide. Okay, so thank you for asking me to talk about the organization. I had a big think about this because, as I mentioned earlier, we have 10 services and some of them are quite different. You've got services that are oriented like towards day residential services, towards service users participating on a daily basis. And then you have services like my own, which is probably classified as a health service within a social care setting. So I thought first about how this process of digitalization is happening right now in a general sense. On the left-hand side, we have what I would think are the agency-wide strategies that kind of apply to everybody who works in our agency. There's the infrastructure there, you know, what tech availability do we have? And this would come across the agency. It doesn't matter what team I work on. What are the funds? What support is there to use this tech? The CMS is a case management system, which is something which is being developed within our agency, and some teams are using it and some are about to start using it, or it's being developed for their needs. And then also within the agency, we have a training department. So these things are accessible for everybody in the agency. But then I was thinking, well, hang on, you've got to focus on a particular service and see what they are doing. And so I want to start first at the bottom here with the service user, because I think at the end of the day, as our agency exists to provide services for service users, so they have to be at the heart of whatever we're doing. And then thinking about, well, what are their skills? What are their knowledge? What is their attitude towards these tools that we're putting out for them to use, and the service delivery options that we're offering them? What do they want? And then I was thinking, well, how does that then interplay with the staff and their skills, their knowledge and their attitude? Because at the end of the day, the staff are the people who are going to provide these services, which hopefully will be service user driven. And then what are our options? What is the tech allowing us to do in terms of online, hybrid? Or are we saying that for some things we have to think about face-to-face, maybe using tech within that situation? So what I want to do next is I've actually swapped them around, 2 examples, and this is actually going to be case example 1, so that we can compare and contrast how this happened within my agency. So if I take the day services, right, so these are services that people access on a daily basis, and obviously prior to COVID, this was done face-to-face, and maybe they used some tech within the services, but generally this was a face-to-face service. And I started to think a little bit more about those service users who access that particular service. And I added on a few more things then. I started to think, well, did they want these services to go online? Because that's something that did happen. Did they have access to the technology? So did they actually have the hardware that was needed to access these services online? Did they know how to use this technology? And then from a staff perspective, we have a lot of staff here who maybe didn't have skills and knowledge around this because it wasn't something they were expected to do. And how were we going to deal with this? And then what kind of service delivery options could we offer? And I've spoken to to people within the agency about what they did about this. And they told me that they decided to talk to service users, and in accordance with their person-centered plan, they moved forward for some of them going into online sessions, and some of them skilling them up in how to use this technology. But they did certain sessions that they did were like things like cookery and stuff that were done online, and the service users were enjoying that. And also they were saying that service users enjoyed this because they got a chance to interact with other service users who didn't necessarily attend their particular day center. So actually, the provision of these services online actually became a socialization event, and created new groupings of service users that weren't there before, because geographically they were maybe placed in different places. The biggest issue that they encountered was staff, and the agency has been working towards that training. Of course, one of the things that they could use is the Entelis program, which is all there to support them to learn to use those skills. Also, not all service users had access to tech, and the agency provided it. And as I said, not all service users knew how to use the tech, and this is a program that they've now put in place. I want to contrast that now, though, with my service, ACTU, another service within the agency. And of course, we're a tech service. That's what we do. We're assistive technology. And I remember the day they told us that tomorrow you're not coming to work. And I remember switching on my laptop and saying to myself, Teams, I have that in my laptop. And I was able to work out how to use it within 5 minutes. But that didn't happen for the people in the other service. Right. So I think we have to think about the staff here, what they know, what it is that they're able to learn fast, because in our case, because we were a tech team, we just picked up the ball, we got out there, we started exploring, and within half an hour, we were able to communicate with each other from different places. And we were already starting to think about how we were going to make our service an online one. What we found was missing, and what we've been working on is, one, we needed specialist training in specific areas. Like, how do I do an assessment for someone who needs to use their eyes to access a computer when I am online and not with the person? What does the evidence base say about this? I can't just start doing stuff. I've got to look towards some research and see what that tells me about this. What does my association tell me about this? What are the ethical considerations if I decide to do things in this way? Is it safe? Is it private? Is this platform something that someone could just crash into by mistake? What are the processes? Do I have consent to do these things? So there were an awful lot of things that we had to consider from a staff perspective. So for us, the issue wasn't how to use it. It was, how to use it from a practical perspective, but it was the much bigger picture of whether this is safe, what my process is. Am I protected as a therapist in doing these things? Is my client protected? And is he still getting the best service he could get? So I want to link this now to the service user. Do they want this kind of service? Do they think it's beneficial? In what way? And I think all of this comes down to outcomes. Are we able to measure these outcomes? Because there's no point providing a service online or in a different way or a digitalized way if it doesn't actually benefit the service user. Ultimately, I think this is the bottom line that everyone has to consider. From our perspective right now, I would say that we're doing some face-to-face because we feel that there are some situations that doing things in an online fashion or in a digitized fashion actually prolongs the process for us. And so we just think, if I want to see how someone is sitting in a wheelchair, I need to actually just get in there because I can see that very fast. If I want somebody to try something and I need to change the settings, yes, I can find ways to do this, but will it be faster, more efficient, more personalized experience for the person if I do it face-to-face? However, we're still doing things online. For example, I'm here today. Secondly, I do reviews with parents online. I troubleshoot problems online. So there are many things I do online, and the big thing that we're doing is hybrid sessions. So I'm assessing someone, we are face to face, he's in the room with me, he has his family with him, or maybe he has some of his family. The rest of the family are joining online, therapists joining online, educational staff joining online. So what we're finding is this mixture, that some of us are there, some of us aren't there, and that experience means that maybe more people can join us and help us with this assessment. And also, of course, I can't just talk about the service users themselves without talking about the other things we do as a team. For example, getting information out there, so creation of online webinars, and it's all there on YouTube. That's not something we even considered doing before, I'll be honest. And also getting people to come to these webinars and conferences that we've run. In the recent conference we ran last November, we had people from Singapore and Canada attend, which we thought, wow, somehow we're now able to reach a much bigger, wider audience in many different countries, which we hadn't done before. So for us, in my team, it's not just about the actual direct service user experience, but also the other things we do that promote the use of technology for people with disabilities. I don't want to conclude too much here because I'm assuming that we're going to discuss.
Yeah, you have to
so
stop.
I just wanted to say as a final thing here that obviously we had to think a lot about who our service users are, what is the capacity of this staff, what are the services that we can offer, and what innovations we can make within those services, and all of this in the wider context of what is the resources available to us, especially funds.
Thank you, May. Thank you. Yeah, some very good points there, especially about how to cope with that, and also how let's say it's impacting on the way we work actually much more. Of course, it's also having a big impact on people with disabilities, our service users, and it would be very important to see how we can maximize that outcome. But at the same time, it's also heavily impacting on the way that services are delivered. And I think you made that very clear. Thank you. Noah, can I move on to you?
Yeah. Okay, can you see my slides?
Yes.
So thank you, May. I think it was great for me what you just present, because we are doing some serious stuff, and I think it will be very interesting. Okay, you see that I'm changing the slides, right? It's if we're talking about digitalization and disadvantages. So I will share with you. You see that I'm changing?
No.
That's okay. No,
not yet.
Okay, I had the feeling.
Full screen, maybe.
Okay, 1 second. I had the feeling that something here is not working. What about now?
Yes. Now, yes.
Okay. So I will share with you at the beginning few things that's going on, and it's related to the COVID, and then a few things that are not related, but they're about the digitalization. So I think it's just important to know that technology is one of our main focus here at BETISI Shapiro, and we are using a lot of technology here, low-tech and high-tech solution. It's not that if you come here and you're all welcome to visit, you see just technology, you see a lot of other stuff, but we do use technology to promote participation and all those other important values. Touchscreen in many environments and other things also. And the reason I'm saying it, because I believe that our staff had a pretty good background, and he's pretty much technological when we have to move to more digital solution, especially with the COVID. Because the minute, it's almost 2 years, right, ago, we had to find immediate solution to support our children and their family, and we weren't ready, of course. But we thought that we have to find an immediate solution to help them to keep some kind of routine. We have very young children with complex disabilities. It's very hard, and it was very challenging. And I agree with everything that May mentioned. We feel the same. It's not easy. We had to learn it. But at the same time, we really got new and very useful tools. For example, so we immediately started to make those videos on YouTube. we have in the virtual kindergarten school in Hebrew and Arabic. And there are hundreds of videos there. It's open, it's free on YouTube, and we share it with our family. Many kind of activity from the teacher, from the OT, speech therapist, etc., about sport, yoga. And we got great feedback because it all was pre-recorded. It was very easy for the family to watch it when it's ever convenient to them. So we start to get great feedback from all over the country, from family that we don't even know. And even because we had also the virtual kindergarten in Arabic, so also countries from outside of Israel, which are Arabic speakers. So we start to understand that we have something very good going on here. Today in Israel, we have the virtual easy kindergarten also in a mainstream TV channel, the Hot VOD. And this is amazing because it's mainstream, it's very inclusive. It's for children with and without disability, and children without disability can see our kindergarten with the sign languages, with the symbols, and it's and to see just in TV, it's really great. Another thing that we find out that therapists and teachers from all the country start to write to us that they just watch it to learn how we work here. So it's become a very good resource. And also now we have so many videos just to use when children at home, to use here. So it's a great resource that we have today and everybody can use it. It's open and it's free. And of course, we had to do also the online session, all the therapies, group or one-on-one. And again, it was challenging. It's not for everyone. But today, we have solution, like I said before, for students that have to stay at home. And it's happening. It's happening if he had surgery, need to stay for a month at home. And now we're just taking an iPad, put it on the stand, on the wheel, and we Zoom with us all day. So it's a great solution, something that we are using. And this is very relevant to what May mentioned. We conduct research then, actually 3 studies about the professional experience and the client experience in Israel and globally. And here are a few examples of testimonials of the people that it was involved. You can see on the top things like it was a great opportunity to engage the parents, great medium for guide and training, possibility to continue therapy and be in contact with the therapist, and also disadvantages like technological difficulties, difficult to maintain attention and more. And I can share with you those links to the research, to all the conclusion, and you can see. And I think it's very, very interesting to see and to think about the future. Another thing that happened, like I mentioned before, we are doing a lot of sharing knowledge in Israel and globally. So we had to move it to Zoom. And it's great because more people can join. It's what we are doing right now. So you can see globally, just in 1 year, we have participants from 66 countries. It's really, really amazing. It could be by courses, by training, but also webinars. And it's really great. And in Israel, the same. So now in Israel, people from the periphery can join us. Israel, it's also a small country, but still we have cities that are 4 hours from here and people will not join. And also for people that it's hard for them to live, and it makes everything more affordable. But at the same time, we have to remember that it's not just taking your courses and just put it on Zoom. You have to do it differently. So it's a new method of teaching. It's not for every student. We know the students, some of them are leaving. And I think very important about training that if we're talking about therapeutic professions, we have to keep it high quality. If we want to give certification about therapeutic, in the therapeutic profession, we want to feel the people, we want to see them. So we have to do it in a balance. And now I want to move to examples that are not related to the COVID. One example is our leadership groups. So we have at BetEasy 8 leadership groups. And one of them, it's the Forum for Health. And they are doing amazing work with the Ministry of Health and Equal Rights Commission for Persons with Disability to promote regulation for the people with disability in this group. And this is what they're focusing in. And one of their main focus is the digital aspect of health services. So they are doing a lot of work about all the concept of the apps and how you make appointment and medical devices which are digitalized, but they are not accessible. And this is very important. Another project that we are doing, it's not about the group, but it's about health. It's accessibility for medical services. And this is an amazing project to guide staff at hospitals or doctors or any service providers how to provide accessibility service for people with disability. And again, there's a lot of digital aspect there. And we also have a leadership group for AAC users. And this is amazing. And you can see a YouTube video how they worked about justice for people that are using AAC. This is example how the technology advanced so much, and now it's moving to all to these areas. And my last example about the technology is our smart home project. It's joint project with JDC and the Ruderman Foundation and some ministries in Israel. And what's so important about this project is that we assessment what kind of technology could help people to be independent at home. On the left, it's a picture of a woman. She's using eye gaze with the AAC system to control her room. It could be the smartwatch for apps for public transportation and more. And it's also with research, and then the conclusion we hope will influence government decision about funding. And that's it.
Thank you, Noah. Thank you. It's great to see how actually technology is really empowering not only people, but also processes and situations, making them more inclusive and more efficient. Some very nice examples there. Thank you. Klaus, over to you.
Okay, I trust you can hear me.
Yes.
Perhaps to start what I said already at the beginning, we are perhaps a bit exceptional to this round because we are not a, so to say, traditional service provider. We were born digital. So we never had the transition from standard services to digital services because we started 35 years ago with digital services, our institute, and now we are servicing about 200 students with disabilities, which is also our research lab. So to say, this is the requirements definition which we have. And as we discussed, I don't talk a lot about COVID. So to say what I already said, COVID was a reinforcement. So to say, more digitization is happening generally at universities in teaching and research, and this makes it much easier to get access, but also there are considerable risks for that. Not much about this. This is what I said already. Assistive technology, accessibility, and digitization, we always had at focus, and the more digitization is happening in society, the better, the more potential is there for people with disabilities. And people with disabilities are at focus for our work, for the services we are providing for them, for teaching, and also for our research and development. I want to make it short and have only one slide. So this is what I said for digitization. So to say, the presentations today, and most often when we discuss in the sector, the view is that we analyze our services and so to say, and then discuss what is needed in terms of digitization. As my background is computer science, and as we started from a more digital view, perhaps it is helpful, and I thought it might be helpful so to say to use the view from digital technology, to say what is digital technology demanding in terms of services which we are changing, which we are implementing, and we all experience digitization is a disruptive process. It questions all the activities we are having, which we designed, and they demand from us that we consider redesigning, change management, and adapting it to the new mainstream situation. And therefore, so to say, it might be helpful to look at what digital technology is actually demanding from us. What are the aspects which are needed for that? And what we see in digital technology is, first of all, whenever there is digital technology and we are interacting with it, it is always the same scheme. We have users which are interacting with a standardized, globally accepted human-computer interface, what we have on our mobile, what we have on our desktop, what we have in smart environments or whatever. It is a standardized interface. And via this, we are interacting with all the technology out there. We use our mobile phones with hundreds and more apps to interact with, always the same interaction concept. And what we need is, for people with disabilities, if they are not able to handle the interface themselves, they need assistive technology to interface the interface. This is our main research activity. Sorry for that. Assistive technology has to be available, and what we learn nowadays, it has to be very personal. Assistive technology has to adapt to the needs and the requirements of the user. And the second issue which we need, which goes much more out of our sector, and this is one of the most challenging aspects we have to bring accessibility into play. Accessibility is not done by the sector alone. We are demanding from mainstream that accessibility is implemented. Only when accessibility is taken into account, we can expect that people with disabilities can better, more independently take part in mainstream society. These are the two domains. And these two domains, so to say, or this scheme, let us at least talk about 7 domains which are of importance in digitization and digital inclusion. The first one, and this was mentioned by May and Noah already, and which is on the agenda, is user involvement, user-centered design. What we still need and what every service provider for people with disabilities needs to develop, to adapt methods, tools, and approaches to do this user-centered design, to make sure that the requirements of end users are always on the agenda. And so to say, this is still an aspect where, to our experience in some studies, a lot of service providers are still struggling to develop a model of this user-centered service design. The second aspect is the assessment between the user and the assistive technologies. Of course, there are many assistive technologies out there, but there is still a strong need to better adapt them to the requirements, to the skills of the users. Still, we are, let me say provocatively, in a very much medical model. We base our assessment on medical treatments of doctors and not on the skills of the users. We need methods, we need data about the users to better understand what assistive technologies are needed for people with disabilities. Come on. The third one is, of course, assistive technology. As said, a lot is out there, but as said by May and Noah already, there is a strong need that in the area, in the organizations of service providers, the skills, the training by people with disabilities, but also by the professional staff, that more training is there, that more skills are there, that, so to say, this quick, fast, and easy uptake of assistive technology can happen. The third thing is accessibility. We need much more expertise in accessibility, digital accessibility in the organizations, and to use accessibility also as a business opportunity to consult, to support. When you go out of the organization, the bus stop, the mayor's office, the theater, the cinema, all the environment, which also they are becoming digital, they have to be accessible. Legislation is there, but the knowledge is missing. And I think that's a business opportunity for service providers together with their end users to work on the accessible environment for them. The fifth one is the human-computer interface. It is changing, it is stable, but we're talking about virtual reality nowadays. We are talking augmented reality. We have smart environments. We have ATMs which are out there with special interfaces. We carefully have to observe these developments to make sure that also the next generation of technology is accessible and allows people with disabilities to participate. All the devices we are working on, ATs, interoperability, standardization, privacy, security, vulnerability of the end users, these are key questions. And we as service providers have to get involved in these discussions and have to have the knowledge about this. And finally, then, when these questions, we must not start from the services, the wonderful services themselves only. We have to look in the 6 steps before we are designing our service infrastructures, our experiences for people with disabilities. The knowledge has to be there, the AT has to be there, the accessibility has to be there, and this would then allow us, so to say, to have a rich digital experience which allows better inclusion, better support of people with disabilities. With this, perhaps 7 recommendations to reflect services which we have, I would like to stop and thank for your attention.
Thank you, Klaus, for conceptualizing so clearly the topics that we're discussing today, and also for already stepping into the final part of our meeting, which is about, okay, what are the priorities, how to move further, how to move forward, and how can we make sure that this process is actually leading to outcomes. And I think you've outlined it so well that actually I would like to ask that question now to May, and then to Noah, and then hope that there's still a minute or so for some questions from the audience. May?
You've already mentioned the term outcomes, Evert-Jan, and I think it's really important that we do assess what we are doing. And there's so many binaries across which we can assess things. For example, going back to Klaus's model, which really enjoyed listening to that. How does the user view things? How does the user's family view things? The bigger environment, the community, and then people like us who have to actually provide services. Ultimately, I have to admit that we are driven by things like efficiency. So the outcomes have to work for people across a range of things. And only once you start to say, well, which outcomes can we improve on, can you start to come up with new things. And so I think innovation is something that we need to think about. Having a defined policy regards innovation and digitalization, because I think for a lot of places, what happens is digitalization is happening, but maybe it's not happening with any real plan. We discover a new technology. We say, let's try it out. But actual proper policies, planning around how this actually comes to be is an issue. And then on top of that, the availability of resources. We have all this mainstream technology that we are now using a lot of. As Klaus said, we try as much as possible to use options that are already built into these. But not everyone has access to this. And even the teams themselves, teams like myself who have knowledge and expertise, it's like a big race the whole time trying to keep up with this technology. And, oh, I've just heard there's this new thing, we have to get this for the team, because I can't actually explore it to know how it could work for this user unless I have it. So it goes on and on and on, doesn't it? It's like you're on a treadmill sometimes. So I think one of the downsides of this is the fast pace of all of this. Okay. And difficulties for people like me to keep up with it, and then to ensure that people can access it financially.
That is a very important point as well, of course. Yeah. Okay. Access to it. Noah, what will be your priorities or recommendations?
First of all, I agree with everything that was mentioned here, so I don't want to repeat. Just add that. First of all, we cannot take the Zoom or other platform as granted. For many people, it's really hard to use. People say that they're supposed to use the Zoom, but they don't know how. There are not enough instructions. There are many things we don't have time now that we can discuss about how to make the Zoom more accessible, even not about the accessibility features, just about how to explain people how to use. And I think, like I presented, there are two main areas. One is the digitalization in health, and the second is about independent, how we can work together to promote this field, but also to see, I hope to see change in regulations, like to have really accessibility regulation in specific for health product and other product that we don't have this gap that we have today.
Thank you, Noah. I was just writing in the chat box. Sorry for the fact that we run out of time, but if someone in the audience has a question, I think we can still take one or two. So
sure.
I don't know whether there's someone that wants to come in. Maybe you can. Alternative, you can write your questions in the chat box, and especially if they're directed to one of us, then we can respond by email if you add your email address as well, or otherwise contact maybe Renaud. You can put your or someone's email in the chat box for people that want to have further details, or Omar, maybe you as the secretary of the Person-Centered Technology Membership Forum.
Yep, sure, will do. Thank you.
Okay, so if people want to contact us, then that can go through Omar. Okay, well then, May, yes, you want to add something?
Yeah, I'm just thinking a bit more about what we've been talking about, and so I'm just going to get rid of my hand. And apart from all this, you know, whether we have access to it, the funds for it and stuff, I think we need to think a lot more about legislation. And Noah, you just mentioned this, but it's all well and good that countries sign up to things like the UN, CRPD convention, but the reality of what happens in every country is going to be different. But a lot of countries may have signed up, or maybe they haven't, and they don't have access to all these things. We cannot take it for granted that it's there. And it would be nice to see if we can have this pushed a bit more. As we in the PCT forum, we have worked on this new policy, and we're hoping that we can make this a bit more of a stronger voice. But you know, it's very easy for people to talk about digitalization without actually having the backup to implement this. It has to come from the top in the end. We can do the best we can as services to know about it, to try and use it, but without legislation, then we do kind of end up in a bit of a hole sometimes.
Yeah, it has to be recognized as well as being important.
Yeah.
I mean, it's clear. I was very much in agreement with Klaus when he spoke that sometimes we still assess a lot of people with out of a sort of a medical model approach, and for a lot of service providers, it's not easy to let's say to change their way of working, because maybe their commissioning bodies do not really appreciate that, or are looking for more traditional ways of delivering services. So that's definitely the point that we have to work on. So thank you for that, May, for raising the issue of the need to have a good policy framework and to be able to impact at all levels on policymakers. That's something that we'll definitely take forward in our work as ESPD and as the membership forum. So the time is over. Sorry for that. Thank you all for your.
Something?
Yes, Noah.
I want to.
We've run out of time. 10 seconds.
Last sentence. I just want to add, because it's so important, and many times when we talk about policy and the resources, it's about the technology, but it's a lot about implementation and training for the stuff like Klaus mentioned. So at the end, we can have technology, but there are really not enough trained professionals. This has to be mentioned
as well. Yeah.
Decision. Yeah.
Fantastic. So, audience, you've seen our emails in the chat box if you want to follow up. Thank you, Klaus. Thank you, May. Thank you, Noah. And I wish you a very, very nice further day, nice further conference, and let peace prevail. Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Thanks a lot. Bye. Thanks, everyone.
Bye.